start recording. I'm gonna send you the link for all of you. You can watch this part, okay? So Sume say working very well for neck pain one. That's good. You did on yourself. Belinda say yes, I have used thin needle, less pain for patient and good result. Thank you. Yes, that's great. That's great. Thin needles. You don't have to use thick needles. You know, less pain, much less pain. So I'm gonna tell you what I did. If you don't get good result for patient, or they feel, oh, okay, a bit better, what do? I say you don't have to do some technique, right? You actually can do, if you do thin needle, you go into the needle and each the needles, take it out a little bit to the surface. So take the needles out, you know, you put a needle in, right? Take it out to the surface and do some needling, you know, gentle one, not like this, okay, gentle one. Just do some gentle needling, and you will find it. If the patient didn't respond at first, then after you did that, it responded very well in some cases, right? This is something that I want to advise you today. Use several times with 5 neck pain, yeah, along with Dr. Chu's scalp in the past. That's great. You can combine with Dr. Chu's scalp acupuncture, no problem at all. So Dr. Tan actually told us the other scalp acupuncture image that is quite different with Dr. Chu's one, but some of them are similar, like from the head to the from head to belly are all the same, right? 上中下焦 are all the same. And I've struggled more with a client with tends to be very anxious type. Any suggestion? Okay, good question. Szenan, so I can't pronounce your name. I'm very bad, aren't I? Okay. For this anxious type, we normally do yin tang, right? We normally yin tang, and you can do ear Szenan. And for anxious, it actually causes from the spleen or the heart, those two organs. And this type of patient, we want to treat the organs rather than just putting in yin tang. You know, yin tang works very well, but not for everyone. Not for everyone. You want to treat the organs. I don't have the chart today. I can show you that how the emotional energy imbalance, each of them that connect to the organs. So once you know how to connect to the organs, then you'll be able to treat the organs. So anxiety, depression, acupuncture can help a lot. Okay, I have a patient come in. This patient, every time she came in, she feel very relaxed, and she loved to come for acupuncture because it makes her so relaxed. And her depression, she never take any medication for it. She know the medication is not good, but since she came for acupuncture, she felt very relaxed with acupuncture. Acupuncture helped her a lot. All right. So we want to treat the organs. Is there a recorded video about neck point? Yes, there is. I'll send it to you guys. So yeah, change to Chrome. Google Chrome browser is better. Yes, haven't tried yet. New start for you. Okay, you can send me the video for 5 neck point. No problem. And review what are the 5 neck point. Okay, now we're gonna start. Okay, we're gonna start right now. All right. Okay, we're gonna go through. No, I want do the would you start with S5, spleen 5 and heart 7 before local balance, or combine? I would say you combine. And what I mean is, yes, you can do those points, no problem at all. But what I normally do is I just do global balance, and I take the pose I I know which organs are out of balance, and straight away just do local balance. And with local balance, I know in the past a lot of people say, well, yin tang good for relaxing and heart seven good for blah blah blah. You know, I don't really do those anymore. You know, not very less I will do those. I really go into the pose and balance the pose. Once I balance the pose, the organs balance, then patient will feel better that way. Okay, let's start today's webinar. So we're gonna talk. I'm gonna give away free bonus as well today. So you're gonna stay in the in, right? I'm gonna tell you how to get the bonus, and I'm gonna tell you. I'm gonna let you know how you get your CPD in the in. Okay, so you don't have to do any survey today because in the in we will run a report. My system can run a report and tell whether you're still on the system or you leave the system. Then I'll be, according to that, I'll be able to do a CPD for you. And for the certificate for last time, you should receive it. So it should be in the email and or in the Facebook group, okay, the closed group that we post over there. The reason that I sent it quite late to you, a bit late, because I need my computer can't do all this certificate because I'm using Mac and I don't know how to do that. And my wife have to do it for me, and I have to wait for my wife to do it because she is so busy to unschool my daughter, which we homeschool our daughter. So they're very busy. So I have to wait for her to do all this stuff for me. So we have a team basically, and I have a lot of work that manage in Malaysia. I have my sister and my brother to help me for my workshop and webinar. A lot of things that they helping me do because I have to manage my clinic and I have a lot of things to do. So in the end, if you want to get the bonus, our bonus is Magical 8. Magical 8 to treat heart problem, to treat lung problem, to treat digestion problem. Okay. I'm gonna share with you. This is only shared with my webinar class, paid webinar class, but you're gonna get it for free. But of course, you're gonna do something for me to be able to get it, right? So let's start. Today's webinar is back 5 points and magical 12 back point to treat all back disorder, including structure and functional. Well, today keynotes. Now, if you have joined last webinar, you find that a lot of the contents are quite similar. I haven't changed any of the contents, but the only difference is when we come down to back 5 points, the instant relief lower back pain one, and here, magical back 12 point to treat all back pain. Those two are different, right? The rest of it pretty much the same, right? So those are actually for the new acupuncturists that your first time to join us today. So the first thing that we're going to talk about is balance method acupuncture high spot, distal acupuncture, and 黄帝内经. What does 黄帝内经say about distal acupuncture? Is there any evidence that in 黄帝内经, talk about balance method acupuncture, distal acupuncture, and acupuncture 1, 2, 3, the concept of it. This is very important because all this thing like back 5 points and magical 12 back point are all from the concept of all based on acupuncture 1, 2, 3. Now in the end, I'm gonna do a promotion of my workshop. What my workshop gonna include when I'm teaching. Okay, high spots. Okay, so number 1 and number 2. Number 1 is instant results. Number 2 is never insert needle on pain area. These are actually Dr. Tan made a conclusion once in his video that he said, my acupuncture 立竿见影. That's what he said. instant results. Okay, and I never insert any needle on pain area. So when I put needle in, within second, you get the result. You can see the result. That's what Dr. Tan said. Okay. The number 3 is easy to learn and repeatable results. That's I made the conclusion on here. I learned a lot of method and over the years, and I actually promote a lot of method and organize a lot of workshop. You know, some of you might know me already, especially in New Zealand. Then all my method that I learn and I promote as very common things in here is within 3 days or 2 days or 4 days after this workshop, you must be able to practice it, you know. And I'm not promoting those classes that you have to learn again and again and again. You have to spend, you get a theory and you have to practice for 10 years to get good at it, to be able to bring the results. I'm not promoting those kind of thing, okay? I'm not teaching those kind of thing. Now, I want you to be able to get the results within 3 days or 4 days or 2 days, right? Just like today, I want you to be able to use back 5 points and magical 12 back point straight away in your next working day. You see a back pain patient, you put needle in, bang, you got results. That's what I want you to learn, you know. It's what I want you want to give it to you, right? Now, balance method acupuncture, you know, has a great thing. It doesn't actually need a lot of time to learn, you know. It doesn't actually require any techniques, you know. You need to be able to do, you know, strong stimulation to get result. No, you don't need. And you have to put which direction to be able to get the result. No. You get to the point, you insert needles, you know, then bang, you got the results. Okay. And of course, some cases you do require to get to the point. Sometimes if you don't get to the point, you won't get results, right? Painless method. Well, someone just mentioned that you use very thin needles, painless, and you get good result, right? So, and balance method acupuncture, you don't need to. Some method you actually require the thicker the better. You have to bring strong stimulation. You know, we're not doing this. Okay, I'm not saying you can't. Yes, you can. I always tell my patient and all my students that if you have 2 methods, all those methods are working for your patient. One is painless. The other one is causing a lot of pain. You need strong stimulation to get the results. Which one do you want to bring to your patient? I'd rather do painless technique to give the result to my patient and to help my patient reduce pain. Then I do strong stimulation causing a lot of pain. And in the end, I will get the same results. You know what I mean? Okay. Now, in 黄帝内经, okay. What do I do now? Okay. Local point selection. In 黄帝内经 in 灵书, 灵书 is the first book. 黄帝内经 got including 灵书 and 书问, right? And 灵书, the whole chapter of 灵书, all talking about acupuncture. All acupuncture theory come from 灵书. I don't know whether you have read 灵书 or not. If you haven't, you must read it. Okay, it's a bit boring, but when I used to read it, I went to sleep. It's very good for sleeping, that book. Very good, fantastic book for sleeping. All right. If you had insomnia, go and read 黄帝内经. But until I met Master Pan, he actually brought me into the world of 黄帝内经. Then he taught us how to, how to read it, how to understand it. And ever since, when I read Ling Su, I got a book in here, Ling Su. When I read it, I actually didn't want to go to sleep. Each time I read it, I said, wow, okay, I know, I understand this now. I understand that. I don't used to understand this, but now I know it. This is what I did in the clinic. Now, and I read it. I keep reading. And say, oh, I got another idea to do this now. I got another idea. I can combine this. I combine this. Oh, what I normally do that it works actually from here. All theory in there, right? So in 黄帝内经, it has distal acupuncture and local acupuncture technique. Okay, if you're selecting the head point to treat headache, that's local acupuncture, localized. You're selecting foot point to treat foot pain. That's okay. That's normal, right? So back pain today, back pain, you select any point in here to treat back pain. That's right too, right? But this is local treatment according to 黄帝内经. Then, but we also 黄帝内经 also show us that you have a lot of other options that can treat back in here. You can choose distal point to treat back pain. But when it comes to distal point, you need more knowledge. Right? We're going to talk about later. Now, in 黄帝内经in here, I'm sorry, I didn't change to translate to English yet in here. So it say, qi on the heart. The heart has a problem. And you choose Szenan and Daling. Szenan is over here, Daling is over here. One is pericardium point, one is lung heart point. You see, pericardium point and heart point over here. Choose those 2 points. Treat heart problem. What does it mean? It means that this is distal acupuncture technique. But you must know how the connection between here and here, right? If you don't know the connection between here and here, you're not going to choose those points. You never understand distal acupuncture. Why choosing those 2 and not those 2, or not those over here, or not in here to treat heart? Because between them, they have a connection, and you need to understand that. And those connection is meridian. And some people say channel. That's right too. Now, one of here it actually say head issues or pain or diseases on the head, and local needle will be in here. It said about 天柱 and 大柱. And then it say 不知 in here in Chinese, no responding after needle here. And it keeps saying that 取足太阳营枢. It keeps saying needle the bladder meridian, which is foot 太阳, 束骨, and over here 束骨 and 通骨. Needle over here. So needle over here to treat head. The head problem is on the top. And needle the bottom. You see what I mean? It already tell you if this doesn't work, local needle doesn't work for headache, you can do this one for headache. There is always another option. There's always another option in acupuncture. There's always another point that you can choose for this same conditions. So you need to open your mind. And here. So in Ling Su, it say, and the second one, it say, if the sickness is on the top, you needle the bottom. If the sickness is in the bottom and low down, you needle the top. If the sickness is on the head, you needle the foot. If the sickness is on the lumbar, you needle knee. You see what I mean? Ling Su already tell us the theory and the principle of distal acupuncture. Now, another one, 阴阳阴象大论, it say, if you're a good acupuncturist, You're going to use the yin to treat the yang. Use the yang to treat the yin. Use the right side to treat the left side. Use the left side to treat the right side. Right? So it said if you're a good acupuncturist, 善用针者, if you're very good in using needles, acupuncture needles, then you'll be able to do distal acupuncture. Now, why do I say that? Now, needle back massage therapies, they do trigger point. They can go to back and release the muscle. Right? An acupuncturist, you can go to the same point, get a trigger point. You go, oh, okay, this is very tight, and needle it. So what is the difference between you, an acupuncturist, and a massage therapist? There's no difference. The only difference is you know how to use needle and they know how to use thumb to release it. But you all get to the same point. You see what I mean? But an acupuncturist, according to Huangdi Neijing, if you're a good acupuncturist, you know how to use the right to treat the left. Use the left to treat the right. Use yin to treat yang. Use yang to treat yin. And then you're so different within with the massage therapies, because massage therapy is not going to use the yin to treat yang, yang to treat yin. You see what I mean? So in acupuncture, you need to do that. If you're good good acupuncturist. I didn't say that, you know, it's from Huangdi Neijing. Okay, this is from Huangdi Neijing. I just pointed out to you that, hey, when you go back to Huangdi Neijing, it actually tells you the standard of acupuncturist, what the level of the standard that you are. So in Huangdi Neijing, Ling Su Guanzhen is say, one of the technique is say, this technique only use left treat, right treat neck, left. Okay. All right. Okay, let's go to step 3. Simple 3 steps of meridian differentiation and treatment. So acupuncture 1, 2, 3 simply just equal meridian differentiation and treatment. Now acupuncture 1 is find out the 6th meridian. Now if you're doing herbs, you won't necessarily talk about meridian, right? If you're prescribing herbs. If you are physiotherapy, you probably won't talk about the channel, the meridian. You're still using acupuncture, but you call it dry needling, based on the muscle theory, trigger point theory, anatomy, right? But not necessarily talking about meridian. When you are doing acupuncture, I'm not saying dry needling, I'm saying meaning acupuncture, the real acupuncture from Huangdi Neijing, right? You must know what meridian is. Okay, so the meridian of how they connect to entire body from inside out. What do you mean inside out? What do I mean inside out is from the organs to the entire body. Okay, then on here, the 12th meridian or 14th meridian, how they actually go from the top to the bottom, the pathway, how they actually run through the body. Where are they? The position, the location. You need to know all this before you do the next 2 steps. So acupuncture 1 is you diagnose. Acupuncture is diagnose. You diagnose the 6th meridian. If the patient say, my pain is over here, what is this? This is bladder meridian. If we don't know about the meridian, you can't diagnose in acupuncture. So bladder meridian is the 6th meridian. And that's it. You finish your diagnosis, which is you complete acupuncture 1. And you move to acupuncture 2, step 2. In step 2, you have 6 different balance system, which I'm gonna show everyone on my workshop. I'm gonna teach that. I want to tell you that I actually have a free video webinar. It's free, and I talk about acupuncture 1, 2, 3, all the theory, and I actually show 3 balance system. And if you want to learn it, you let me know. I actually share a lot in my Facebook. You can just log in and sign up, and then we'll send you the email. Okay, so then if you want to do distal acupuncture, you need to know the 6 different system in here. For example, now we have acupuncture 1 is bladder meridian, right? Through the 6th system 1, you'll be able to use small intestine to treat UB. System 2, you'll be able to use lung meridian to treat UB. System 3, you'll be able to use kidney meridian to treat UB, right? System 4, lung as well. We have lung already. System 5, it's small intestine. We have small intestine already. System 6, you're going to use UB meridian. So you have 4 meridian. Let's say if a needle in here, it normally works very well for you. But if one patient doesn't work in here, it didn't work in for this point, what can you do? You do distal point, and you can choose small intestine. If small intestine work for you, that's great. What if small intestine doesn't work? Well, you can choose lung meridian. What if lung meridian doesn't work? You can choose kidney meridian. Now, what if number 1 meridian work, but it's not complete? You want to add more. Can you do that? You can add more meridian to combine more meridian to treat it? Yes, you can. So you have a lot of options. If this one doesn't work, I have backup meridian to treat it. Okay. And one of the beauty to use distal acupuncture is, if you needle here, you ask the patient to move to test out whether it works or not. Your patient can't move because the needles are over there. Once you remove the needles, and because the needle localized, the patient say, I'm still painful. I'm still feeling the pain. I want to ask, is the pain causing from the needles, or actually the pain is the actual pain that in the back before your needle? We don't know. Okay. But if we do distal acupuncture, you can ask patient to move. They can move freely, they can test it out, and they can tell you, oh, now the pain's gone, or the pain's reduced. And that's great, because you haven't done any needle in here and the pain reduced, which means the acupuncture work. If you're doing locally, if you're doing strong stimulation, after the stimulation, and the patient will feel some tension or some pain causing from the needle, it may last 1 or 2 days or few hours in some cases. In some cases, of course, nothing. They won't feel anything, and that's great, right? So distal needle has a beneficial for, 立竿见影. You get instant result. You don't cause any pain. If the patient get more pain afterward, after the needles, after a week, whatever, it's not causing from your acupuncture, because you're doing just distal acupuncture, right? Now, acupuncture 3. Now you choose. You have 6 meridian. Is acupuncture 1 that is bladder meridian. Acupuncture 2, it can be small intestine meridian. System 1, system 2, lung. System 3, kidney. Let's say those 3. And which point do you want to treat? Which point are you going to needles? Which point are you going to needles? On here as well, kidney, right? And lung meridian. Which point are you going to needle? So we use as point. If you choose the point according to holographic theory, 全息, okay, image. Or you can use your experience point, right? Like 后息 are very good for neck pain. 后息 also very good for lower back pain. And or 尾中 are very good for lower back pain. But when it comes to 后息, means when you're choosing small intestinal meridian, you choose 后息. If you're choosing 尾中, then when it comes to UB meridian, you can choose 尾中. Okay, but if the back pain is actually the sick meridian and here and gallbladder meridian, and you're using 后息, which is small intestine, or 尾中, which is bladder meridian, it's not going to help because the sick meridian is not in here, and those two meridians can't balance. GB can't balance gallbladder meridian. Okay, now we move. You can see the tongue, and according to the tongue, you choose the needles. You can do the theory on time, 4 season. So Dr. Tan teach season balance, and I actually have my own time season point. It's out of 黄帝内经 and Nanjing, 2 different systems, and it's much easier. You don't have to go through Bagua and anything. You can just choose the point. Just look at your time. What time is it now? Okay, this is time, right? It's better to do this point, and doesn't matter which pattern you come in, you go to those points. Much easier, and it works. And I only tried it out on 黄帝内经. I haven't got much time to try it out on Nanjing seasonal point selection yet. Okay, I'm not sure which one is better, but if I have a chance in the future, I'll teach you all this. And I do a lot of post-diagnose to choose the point. And you can do 八字 and 五运六次 or 卦. Next. Now, we're going to talk about in here. First, we know that this webinar is for back pain, right? Now, in acupuncture, we need to know what meridian actually run through lower back. The first one over here, GB, is on the side, gallbladder meridian. And as it moves toward to the spine, you get UB, bladder meridian, another UB. So UB meridian has 2 in here. And as you move to 2, and between UB and 2, there are 华佗夹脊, right? And 2 meridian. So they are also, if the patient come, probably will tell you, hey, the pain is over here. Then you know it's UB. What about here? Yes, it's UB. What about here? Is it UB? Is it GB? No, it's between. So it's between UB and GB, right? So what about in here? It's not 2, it's not UB, it's not close enough to 华佗夹脊. Okay, it's between UB and 华佗夹脊. This is your diagnose. So first, you want to do acupuncture 1. You need to know how many meridians go through back meridians. Of course, there's another one called Tai Mai, right? But we're going to discuss all this only. We're not going to discuss Tai Mai. All right, keep going. Now, acupuncture 3. If you attended neck 5 point, you've seen this image already. So, acupuncture 3, we use holographic theory. In holographic theory, this is the second metacarpal bone. Over here is head. Going down here is neck and shoulder. As it's moved down to here, this is your belly button. And the same level of lumbar 2 over here. So between here and here, what is this? This is what we call 下颌骨. Sorry, my daughter is playing. I probably need to talk to her. It's a bit too loud. I'm sorry about that. Maya, you're a bit too loud for me. What's so funny? Thank you. Oh, sorry about that. She's going to bed, but I don't know why she's so giggling about a lot laughing. She actually naps here. Okay, now thank you. So yeah, so on this point is actually very good. In the Chinese textbook, we call this the tooth pain point, right? 下颌骨 is good for tooth pain, right? So over here, this is lower back L2, right? So which means upper back is over here, right? Upper back's over here, and move down to here. That's lower back. So when it comes to the fifth metatarsal bone, again, this is the head, neck, and shoulder over here, and as it move down to here, it's navel L2, same as here. So we know the image over here is in the bottom here, to your heart. So your heart is over here, right? To your heart as it go. So this is what? This is the this is the lumbar area. Now here is the back 5 point. I was showing you here. Second metatarsal bone from here, neck, go down to here, over here. This is lumbar. So you needle here, lumbar, between first and second metatarsal bone, second between the second and third metatarsal bone, third and fourth metatarsal bone. Sorry, over here, right? Second and third and fourth and fifth metatarsal bone, and out of the fifth, on that side, which is small intestine meridian in here. Okay, so 1, 2, 3, 4, 5. You don't needle here. If you want needle here, that's okay too. Okay, you needle all young, expect. This is about in, close to in now. You all needle young. Okay, so this is 5 back points over here. So across here, this is all in here. And Chinese is called Wan Gu in here, and this is called Ling Gu and master tongue point, right? And this is called Zhongzhu in Chinese, and this is Sanjiao meridian. Okay, now we know small intestine meridian, Sanjiao meridian, and what? This is large intestine meridian, and there are no meridian over here on those two. Right here, those two expect, right? No meridian in here, but can they treat anything? Yes, they can. They treat between. I'm going to show you what I mean. All right. So this is acupuncture 3. This is acupuncture 2. So this is what I put in my course. I said I actually narrows down to imbalanced method acupuncture. You have 3 steps. Those 3 steps are very powerful. Dr. Tan told us. Dr. Tan actually show us how to do acupuncture 1, 2, 3. Simple step. But I found for a beginner, when you learn balanced method acupuncture, you always stop. And there, acupuncture 1, you get the 6th meridian. Then acupuncture 2, you're going to find out, which meridian is going to be better. Which meridian is going to be better? Is system 1, system 2? A lot of people ask me, is system 1 going to work better or system 2? or system 3? I said, either one gonna work. Don't ask too much, just needle it and experience yourself, you know. In acupuncture, you learn to practice. Also, you practice to learn. So you don't have to know everything to be able to start treatment, you know. Good is good enough. Good is good enough. Jimmy told me good is good enough, you know. So you already have the theory, you know, and you want to choose the best between 6 different systems. I'll tell you 6 systems gonna work, and a lot of people keep asking me, which system work better? Do I choose system 1 or system 2 or system 3? I say either one. Okay, let's have a look. Acupuncture 2. So I found a lot of people stuck in there, acupuncture 2, and then keep thinking. And now I'll show you how to simplify acupuncture 1, 2, 3 to acupuncture 1, 2. So you got acupuncture 1, then you straight away go to acupuncture 3. You skip acupuncture 2. But by saying skip, you not actually skip, because you know how they go through now. You know how they balance it already. So like this case, this is acupuncture 1. Then we go straight, the needle, the patient come in. I know back pain, right? I go straight for back 5 point, acupuncture 2. Finish. I actually don't go to the meridian balance meridian theory in here. But does the meridian go meridian balance meridian, do they actually assist? Yes, they do. And here, without this theory, you don't know why you want a needle in here. You just needle image, and image, it doesn't always work. The powerful in here is because it has the holographic theory as well as meridian balance theory, both together. That's why it's so powerful. It can bring it can bring instant results. It can deliver instant results. Now we have in here small intestine meridian, right? Then small intestine meridian through acupuncture 2, system 1, it can balance UB meridian. Now, Sanjiao meridian over here, Sanjiao point, Zhongzhu, through acupuncture 2, system 1, it can balance gallbladder meridian. So you see 2 meridian. Now we're going to go to the bottom, large intestine meridian here. Large intestine meridian over here. It can balance kidney. It can balance kidney. So where is kidney meridian? It seems like we didn't mention about kidney in the back meridian. Let's have a look. Is there any kidney meridian in here? No. Where's kidney meridian? Over here. And this point can treat kidney organ as well. And it can treat kidney meridian level in here. Okay. Now we know this one treat bladder meridian, this one treat gallbladder meridian. We know 2 meridian in here cover from those 5 points. And we know this one actually cover here. Right? So what about those 2? The third and the point between the third and the fourth metacarpal bone, where it can treat, it actually treat the problem between UB and kidney. UB is here. It treat between here and here. You see? Which means bladder and kidney. bladder meridian in here, kidney meridian in here. So anything from here to here and between those two meridian is treated for this point and this point. Second and the third metatarsal bone, it actually as well treating between anything between UB and kidney. So those 2 points or those 3 points, this one as well, because this one's treating GB as well, right? So GB, it treat GB and it treat other thing, I don't know where, but anyway, it's between bladder and kidney, treat between here. So now you know, when it treat back 5 points, Dr. Tan told us it's for back, but it actually for for tummy pain as well, for stomach pain as well. If the stomach pain in here, try it. Use back 5 points to see whether it works or not. Now, your needle here, you need to be in your mind. This is actually at the level of your lumbar 2 and what? And belly button. What if the pain move up to here? Then you move the needle to here. Move it up toward to here because this is neck, right? So this is neck, lumbar, L2, neck. Do you get me? So neck's over here, L2 is over here. Anything in here, you just move your needle in here. Or you can put, if the patient has pain in here and pain over here too, needle here and here. So when you needle here, get the patient, don't ask them to open the hand like this, fingers like this. Close down like they're holding something loose fist. Make a loose fist. You know, there's Chinese practitioner in here. So 半握拳的状态, okay? So loose fist and needle. And when you needle, ask them to keep this position. Do not move fingers because it's gonna cause pain in there. All right. That's about it in here. Okay. Question, same as last time. You can't see. Some people say can't see due to 腰痛. Yeah, that's right. Aaron, do 2 of those points correspond to 腰痛穴. That's right. 腰痛穴. And 经外奇穴, 腰痛穴 is actually on those points. That's why they can treat, because they actually have a strong, the theory is actually based on holographic theory in there. Okay, show you the location and loose fist, no problem. Okay, over here. If I can find a pain, yes, I could read one. So this is metatarsal bone. Let's do this here first. So from here, you go down here and here, and here you go down to here. So it's actually in the corner, 2 bone. You just run through there in soft part. You can't go any further. If you go further, it's going to be touching the bone, you know, before the bone, soft part. Okay, so you go, fingers go there, and you go up here. Here you go. If I go through it, it's going to be hard. And then here, going to be, you find that there's hollow still. You can push it in. Right? So over here, 1, 2, 3, 4, 5. So if neck pain in here, we needle here, right? Neck. This is neck. This is lumbar. So what about between? You can put this in here. So if you can do needles, All right, let's talk more about how needle. There's a lot of needle technique. Actually, once you needle, you can get a bit longer needles. All right, you can put a needle in here. If they have neck pain and lower back pain, it's simple. So you put needle in here. You don't have to put a lot needle. You can put 1, 2, 3, right? Cover the whole back. 1, 2, 3. Yeah, that's gonna be a lot of needles, right? So you can put 1 needle in here, or 1 needle in here, whatever you want to do. That's it in here. You put needle in here, straight needle in here to this point, going in and out. Change the direction. Go to here. So 1 needle, 2 point. You're gonna treat from the neck to the lumbar. Simple, right? So same as here. Your needle here, needle in this point. You go in, you take it out, you change the direction to here. Does it make sense to you? Or you can go to here as well. If you're choosing that point, let's say you're choosing that one, you go here, you go in, you take it out, you to it to the fingers, which is like this. Then you needle to it here, to the neck, and you treat the whole back with 1 needle. Of course, that's required technique, right? But in the balance method acupuncture, you don't need to learn those. You just put more needles. So this is multiple needles technique and less needle technique. So I'm showing you in here. I actually teach it in my workshop. All right. So I teach this how to needle this. You know how the principle. I show you in here for free. How great is that? All right. Let's see, what question do you guys have at the moment? Do you have any question about this? Oh, some people can't see the pointing. I can't help you with that. I don't know why you can't see it. So as locations, some patients are sensitive to pain. How can needle without pain? The needles, you do require some, ask them to cough, sniff in a needle. Thank you. Wow, yes, great idea. Thank you. We need her how to choose which point to needle in hand, as there are 5 points for back. Wendy, you missed the point. You needle 5 points at the same time. 5 points. That's why we call back 5 points. It doesn't matter where the pain is. When the patient comes, doesn't matter where the pain over here or the pain come to here. You just needle 5 points at the same time. 5 together. 5 together. You don't choose. When the patient comes, you don't have to ask big pain. Where is the pain? No, you just needle 5 points. And then you ask the patient, now, how do you feel? Better? That's great. Still painful? Show me where exactly the pain is. Then you go precise. You go to acupuncture 1, 2, 3. Otherwise, you just do acupuncture 1, 2. 1, 2. This is 1, 2. When you do acupuncture 1, 2, you save a lot of time. You can treat patient very quick. Wonderful needle technique. Needling technique. Thank you. Can I use 0.18 plus 0.13? Yes, you can. So you can do that. But when it comes to balance method acupuncture, we now are talking about the balance, the image, the holographic balance, as well as meridian balance, right? We're talking about meridian and this area and this level, right? Because the same meridian over here, so you must watch this. I'm going to tell you the bladder meridian in here. So but which point do we choose? We're going to see which level is on the top, closer to here, and then if you use only thin, short needles, how deep is the pain? Is the pain going just superficial or going deep? You see what I mean? Yes, of course, your needle is fine. You don't have to do big needle. If the pain's deeper, then you want the needle a bit deeper. Otherwise, you don't. Some cases, you want it to. Some, you don't need to. Just short needle will be fine. No problem at all. How do you know? You ask the patient, how's the pain? Is the pain deep or superficial? And after needle, when the patient feel better, and the pain is still on the same spot, and it feel better, and you ask the patient, is the pain quite deep? He said, yes, needle deeper. You know, and ask patient, show me, where is the pain? Where does it go? It go halfway to your body, or very deep, or just superficial, very close to the back? And the patient will tell you. Or some patients didn't know that. Just try it. Go deeper and pull it out, and go deeper and see how's the result. Just simply test it out rather than keep asking the question and keep finding it. Do I need to ask yourself the question? Do I need to get deeper? No, just go deeper. Doesn't matter. I don't understand about muscle layer. Sume, Takayuki, Hashimoto, same point for all patients. That's right. Easy. Same point for all patients when it comes for back pain. That's why I said it narrows down from 3 steps to 2 steps now. Quick and dirty way. Aaron, according to the theory, I wonder if the foot would do the same job. Would you use any distal point? I'm sorry, Aaron, I don't know about the English code. So combination with these points, obviously, according to acupuncture 1, what is the 6th channel? I don't know about bladder 62 and kidney 4, where actually the point is. But yes, according to the theory, yes, you can do it on the foot, no problem at all. Yes, but it's simple, easier to do it on hand. Yes, clever. You can do it on the feet. It works too. I tried it before. Yes. That this point can treat pain on sacrum area? Yes, it can. But if it's really low, this point over here, it treat here, it can treat here. But if it's lower, you need to needle lower. You need to needle here. This is sacrum. This is only come to lumbar. All right. This is sacrum. Sacrum's over here. The wrist bone in here. I think 8 of them in here, right? You needle there. Check and palpitate bladder 62. Szenan. Bladder 62 Szenan. Szenan. Don't know about Szenan. Oh, bladder 62 is Szenan. Thank you. Would you use any distal point? Szenan. I used to use that Szenan to treat back pain, and now I don't actually use it. You can, of course, nothing wrong with that. You can use it as long you have your theory supported. Why you know why you use it, and that's okay. And you use it, why you use it, and you use it, you have theory, and that's okay. I use Szenan and Hosi, a combination. Are you kidney 4? What's kidney 4? Zhao Hai. Okay. Now, Zhao Hai actually go with Lie Que. Szenan actually go with Szenan, bladder 64, 62, actually go to Hosi. When you come to Ling Gui Ba Fa, I don't know about you heard about. I used to use Ling Gui Ba Fa and check the time and needle. Those are best combination for back pain. Yes, you can do that, but you need to check the time. If the time's not right, it won't work well. All right. Yes. If you know the theory, you can choose anything you want. And do you needle unilaterally or bilaterally? Okay. Use the opposite side. You can use the same side. If you know how to look at the leg, and then you know which side is better. In this case, doesn't matter. If the pain is on here. If the pain in here, you needle that side. If the pain is in here, you needle this side. If the pain on both sides, either side. Either side. All right. Why? More and more questions. I love questions. Thank you. I had a patient previously who had no hand. That's why I asked if I can do the food. Good question. Same thing. Yeah. Yep. I have patients have no hand as well. And I have patients come with paralyzed, you know. Yes. Good thinking. And if there is no hand and no feet, scalp acupuncture and abdominal acupuncture. We always have a lot of idea in acupuncture, you know. That's good. Thank you, Aaron. Belinda, can we just needle just one hand or both? Normally just use one hand, Belinda. Do you needle both Winnie hands together? No, just one. Listen, just checking. Did you say that wrist is for sacrum? That's right. The wrist over here, sacrum. How long do you have to remain the needles? Good question. Dr. Tan said about 40-45 minutes, and I said about 15-20 minutes, half an hour. That's good enough. In some cases, I don't even lift the needles. I just in, out, in, out, in, out, in, out, in, out. And ask patient, try to move your back. And then move. That's good. Off you go. Can you needle the inside of the palm of the hand? Yes, you can. Yes, you can. But it's very painful though, and it's very difficult to get to the point. You know, 中指中线, a needle in here is very painful. One needle in here is very, very painful. Yes, you can do that. You can do the needle, go to here, but we will find that needle from here to here, very painful. Needle from here to here. If you needle deep, you will see the needle come out here. Not actually go through. You can see the needle actually pointing in here. That skin come up with the point, the tip of the needle. You can see that. I've tried it before. I see how deep can I go because the patient pain is quite deep. I put it in, and I can see the tip of the needle over that side, and not much pain at all for those patients. But if you do that in here, it's going to be a lot painful, you know, much sensitive in here. What about pain in the central, and what determines how long you leave the needles? All right, good question. Pain in the center. This is what I'm talking about, the question for you guys. Way to treat pain in the central. Yes, good question. We only talk about UB meridian, and we only talk about bladder meridian and gallbladder meridian, and then between gallbladder and bladder. So what about meridian? Give me some idea. This is your homework. This is what I come to here. Way to treat meridian, because in here we don't put any needle. None of the needles actually target meridian, but you'll find that some meridian pain will disappear with those five needles. But some cases, most of the cases, the meridian remain there. The pain in meridian on the central, on the spine, remain there. It doesn't work for that. So where do you treat it? Here's your question. Here's a question. Do you ask patient to move back after needle? Yes. Yes. I will actually show you how to ask the patient how to get them move in my workshop. Right? This is how I normally do. I always test out the patient first, do some exercise, ask the level of the pain before I needle. Why is that? Because I want to measure whether I put the needle in, whether there's a result or not. Some patient, you put needle in, the pain reduce, but it actually doesn't increase or doesn't help the mobility, doesn't help the range of movement. So you want to test both. One is asking patient the pain level, the other is range of movement. You want to check that, and I'm gonna show you in my workshop how to do that. When I treat patient in the workshop, and I will show you how you actually ask the question and do that. Very quick one. Treat run meridian. That's good idea. Treat run meridian. Which pain in here, you can treat run meridian in here center. That's good idea. One of the options. There are more. Scalp acupuncture. Yes, good idea. Scalp acupuncture is from here to here. 220. I think 220 is 百会, right? 220 is 百会. 百会 point is L2. Alright. So L2 on 百会. Then upper back is from here. Go up to here. This is the neck. Right. This 2 meridian on the top of head can treat 2 on the trunk and run on the trunk. Okay. Good idea. So we have 2 ideas now. One is on using the front run meridian. The other one is on using 2 meridian. And scalp or do mine. That's good. Thank you. Needle scalp for 2 pain. That's good. That's good. Marianne. Trick run for 2 pain. That's good. That's right. That's right. You're right. I would presume system 6 treat like for like, so if pain is on 2 my, treat above on 2 my back of occipital above 2 my. Yeah, you're treating here, right? You're treating here, right? That's a good idea. Or you can treat here for here. That's okay too. That's okay too. Okay. SI4, small intestine 4 must be whole C, right? Whole C is good too. Yep. Good idea. Good idea. All good idea. Yes. This all work. This is all work. Okay. When we talk about occipital, all right? Occipital, we have. Oh no, sorry. You can use occipital to treat tailbone. That's one option. But sometimes it doesn't work. I tried it. Oh, okay. I tried my patient. It worked very well. But tailbone, there are other good places to treat it as well. I tried it before, and I leave it for another time. This is my secret now, because we're not talking about this today. Let's say, okay, let's move. Okay, move forward. For tailbone is around SI8. I don't know about SI8. Which one is SI8? I'm sorry, I don't know about the code. Martin, I'm good at the Chinese name. Okay. All right. It's about the keynote, my workshop. Okay. Right. It turned to, again, the same as the last time. Wow. I told you I'm going to do a promotion, right? About my workshop. So in my workshop, I'm sorry, this is not good. I'm going to turn it to, I don't know why it present like that. In my workshop, I'm going to conclude, it's going to including a lot of 小海 for tailbone. That's great. Good idea. Thank you, Martin. Yeah. Everyone learn from Martin. 小海 for tailbone. Okay. I never use that point for tailbone, because I don't know whether it works or not, but thank you. I will try it next time. Thank you. I have other idea. All right. It works very well too. So my workshop coming out in next month. It'll be in Auckland. Okay, from the 13 to 15. From the 13 to 15. Let's do this. Okay, give me a minute. Give me a minute. Since so you can't see it, so I'll place it in here. So I'm gonna go through acupuncture 1, 2, 3. The more important part is I'm gonna show you guys how to do holographic theory, for hands and legs to treat the entire body. All right. And how do you just needle, hand, and legs? You can treat the entire body. Okay, you don't have to get patient to move the clothes, remove the clothes or paint and things like that. Right. This is the beauty of balance method acupuncture. And I'm going to show everyone how to do local balance. And more important is smart pick. You know, local balance. I just show you neck 5 point and back 5 point. They are belong to local balance. Okay, nothing to do about global balance, right? In this case, learn how to speed the process when treating patients. So simply acupuncture 1, 2, 3. Simplify acupuncture 1, 2, 3 acupuncture into acupuncture 1, 2. It's 2 step. You don't need 3 step. You know, but first you need to know 3 step, and then we can simplify 3 step to 2 step. All right, and so learn about Dr. Tan liver point and gallbladder point, right? Then we're gonna focus on the other thing in Dr. Tan Balance in my workshop. So we're gonna focus on in here. Number 8, global balance. Global balance, it comes to 12 basic global balance pattern. So all these 12 basic global balance pattern are good enough for all internal disease. Then how do you use it? When do you use it, right? And how do you choose the point? Okay, I'm going to introduce Magical 4 and Magical 8 and Magical 8 point plus 1. And Magical 8, I'm going to put it in this bonus webinar. So if you do something for me, and I'll give it for free. Then Magical 12. We're going to focus on Magical 12. Magical 12 is actually on the advanced class, and I bring it into the core foundation class because I use it a lot in my clinic. A lot. How I treat diabetes, high blood pressure, and cholesterol problem, and all internal disease. I use Magical 12. And the way I use Magical 12 is very different with Dr. Tan's. So Magical 12 actually developed from Dr. Tan's, and he used holographic theory on Magical 12, and I actually use pose. I use pose to find out which organ do I treat, and then I needle 12 needle. I have 7 different strategy, and I can teach you straight away. And pose, people are scared about pose, and my pose is so simple, and within a minute, I take pose 30 seconds, the most a minute, and I know which one I need to treat. I just show you guys. I did a live video about how I treat menopause using herbs, and I use pose. It prescribes the herbs, and the patient walk in. We spend about 2 minutes to talk about her condition. Then I spend about within 10 seconds to 30 seconds. As soon as I take the pose, I know which one I need to treat, and I write up a prescription. And within 3 minutes, we finish. You give the workshop only in New Zealand. Are you coming to Europe in the future? Good point. Annalie, are you in Holland? With enough interest, we could get him to. Yeah, contact Szenan, because she's going to organize it. Let's say that you're going to organize it, okay? Now we're gonna do it together, all right? So yeah, show your interest and email us if you want to attend my class, okay? So with pose are all from Huangdi Neijing. If you go back to Huangdi Neijing, if you follow my video, you know why you want to use pose, okay? Pose are the way that directly you can find out which organs you need to treat. And if you don't treat the organs, you just treat the symptoms, you never get to the bottom of the problem. You're never going to help your patient further, and you are going only to treat the pain. You always stop to treat pain condition. As an acupuncturist, you can do more, okay? Okay, next thing. I'm gonna show you. Hang on. Oops. I don't want this. Hang on. I'm just managing my computer. Too fast. Okay, next thing. I'm going to show you how to do less needle technique and multiple needle technique, when to use it, okay? And of course, I'm going to needle in the workshop and show everyone how I needle it and how you ask the question to a patient and everything, like something like that, right? So I actually, Dr. Tan used to teach a 4 days class, right? So the reason I can narrow to from 4 days to 3 days, Dr. Tan used to just draw on the whiteboard and everyone just draw everything on the whiteboard. Then he started to talk. He spent a lot of time drawing, but I'm not going to do this. I'm going to put it all in PowerPoint. So I'm going to give you PowerPoint. I'm going to print it out to you. You can show you, and you can just do the notes on the PowerPoint on your notes. You know, you don't have to draw everything. Therefore, I save a lot of time. I can 4 days class, I actually put it down to 3 days. Save a lot of time. Apart from that, I'm gonna I actually give you a bonus to teach you 12 magical point, which this 12 magical point technique I actually introduced only in advanced class. And not only that, I discover how I do pose and to get even better results magical 12, and I'm going to show you how to do that. And anyone, if you sign up my workshop in Auckland this time, you're going to get a bonus of free access to my balance method Acupuncture-Local balance webinar with conditions. We will let you know how to get this bonus on the day of the workshop. Okay, now the next thing, let's look at the in my workshop. There's something that we need to discuss. Okay, we need to discuss the following methods. Why result of balance method acupuncture does not last in some cases? You know, the common question for a lot of people in the beginner when you do balance method acupuncture, why it doesn't last? We need to discuss this. How to treat frozen shoulder. Frozen shoulder is difficult when it comes to range of movement issues. You know, without knowing local area, can you get balance method acupuncture to get the range of movement, improve the range of movement? Yes, you can. You know, Veronica from Peru, and she contacted me a few weeks ago. She actually posted in a group, and she said one of the surgeons that she treated using balance method acupuncture, and she got no pain, but just couldn't move her arm up. And then I showed her how to do that, and she needled it, and bang, it works. Right? So how to treat what is the acupuncture strategy for diabetes? How do you treat diabetes with balance method acupuncture? Right? Does acupuncture only treat pain conditions? You know, no. Acupuncture can treat a lot of different things. Okay, so helping your patient, is it what you want? Okay, that's the question. Helping your patient to reduce medication, eventually stop medication, is it what you want to do for your patient? If that's what you want, then you need, if your question is yes, right? So what acupuncture technique in theory do you need to know about it? Right? So you're not treating the conditions, the symptoms only. You want to treat the root, and the root is the organs. How do you balance the organs? And what sort of technique do you need to apply? What sort of knowledge do you need it? So I use Magical 12 according to post-diagnosis. So this is one of my most powerful strategy that I use for my patient to help them reduce medication. When I say reduce medication, you know, high blood pressure, diabetes, cholesterol pill, all this pill, you know, and I'm not just doing it myself. I do it with patient, and I want them to go back to GP and tell the GP about it, and get the GP consent, get the GP help. GP need to teach them how to show them how to gradually get off the medication, because I don't have the right to stop the medication, but patient have the right. And how do we make sure? We can talk all about it in our workshop. So we need to know how many people are interested. Okay, yeah. Go to our, send an email to us, show interest that we will collect your name and email. I may be able to go to UK in May if we have enough interest in Europe. Thank you. And the last thing, the next thing is, okay, this is my workshop. This is the venue, and in Auckland, on this time only, and your super early price is in tomorrow. It's $899 New Zealand dollars. It's gonna in tomorrow. So the full price is 1,500, but the super early price is gonna in tomorrow. If you want to register, you need to do it now and pay it today. Otherwise, you're gonna miss out. The next one is the great news for you guys. If you are one of my students and you bought my webinar, or you have attended Dr. Tan's or Eileen or Delphine workshop before, 4 days one, then you can come in to sign up with my workshop with only $599. Yes, in tomorrow. Okay, in tomorrow. That's it. I think I do enough. I got enough promotion for my class already, and we should keep going, right? Keep going with Magical 12 back point. Now, holographic selection of points. Look at this picture. Belly button is over here. Belly button actually treat balance, elbow. Okay. You see over here, the picture over here, the belly button, L2, it treat elbow. When it treat elbow, it actually treat knee as well. Then where is tailbone? Tailbone is wrist. Tailbone is ankle. Okay. So anything below here, then you can move the needle, go down here. Okay. I'm going to introduce 12 different points. So you will find all this point on 12 meridian are actually on the 核心 point. 合谷 point, 核心 point. 颈行枢经合 point. Okay. So lung 5, pericardium 3, heart 3. Right? Lung 5, pericardium 3, heart 3. Where are they? They are on the elbow. Right? And on the opposite side, in meridian, you see the in meridian on the opposite side. Spleen 9, level 8, kidney 10. Opposite side, in, match in. On the left side, left hand, large intestine 11, Sanjiao 10, small intestine 8. They're all young meridian on the elbow, right? So on the opposite side, which is stomach 36, GB, gallbladder 34, UB 40, bladder 40. So on the opposite side. Now, do you see this global balance? It's a bit different. We needle hands and legs. And where do we needle? If we needle 3 in here, 3 hand in, on the opposite side, you need 3 foot in here. All right? Then, where about yang meridian? 3 hand yang, you needle over here, that side, which is in here. How about 3 foot yang? You needle the opposite side of the 3 hand yang, the opposite side over here. So the match. Do you see the match? Now, what if I put hand yang over here, over that side? If we put 3 hand yang over that side, then 3 foot yang is going to be the opposite side. Can you see that? Yang, hand yang, foot yang. Then, how about 3 hand in? Change it here. 3 hand in. How about 3 hand yang over here? 3 hands yang. Foot yang, sorry. So it'll be in, yang, in, yang, in, yang, in, yang. You see what I mean? Okay. Simple, right? Very simple. 2 different strategy in here, same point, 2 different right and left side, 2 different sides. Okay. Simple, right? Now we're gonna go move forward a bit. Okay. Acupuncture 2. This is acupuncture 2. Okay, I didn't write it down. This is all acupuncture 2. This is acupuncture 3. Acupuncture 3. Point. Now acupuncture 2. Now acupuncture 2. Lung. Let's look at the meridian, how they balance the meridian. All right. Lung balance UB. Hershey point, yes. So this point target all back pain, except for du meridian. Except for du meridian, all right? I'm going to show you another way to needle du meridian. Now, lung treat UB, and heart meridian treat gallbladder. It's through 6 system meridian, 6 system balance system, right? Then between UB and GB, who treated? Pericardium. Pericardium treat between UB and GB. What? 3 hand in. That's 3 hand yang. 3 hand yangs over here, right? Let's see. Small intestine treat UB. Sanjiao treat GB. And what about large intestine treat kidney? So kidney organs, and it also treat between UB and GB. Right? 3 foot in, spleen meridian, liver meridian, and kidney meridian. Kidney meridian treat bladder meridian. Liver meridian treat gallbladder meridian. And spleen is between liver and kidney. So spleen can treat bladder and gallbladder. That's simple, right? Stomach. 3 foot yang, stomach, GB and UB. Now, UB, of course, it can treat UB itself. GB, of course, it can treat GB itself, right? So stomach is between, no, stomach is in the front. Okay, stomach can actually treat between GB and UB. Okay, that's, I think this done. I put 2 GB. That one is UB, sorry. But anyway, those 12 meridians, it can treat all back problem. When I say all back problem, all back meridian. Right. Now the question is where to treat du meridian. You have answered all my questions before, and I now give you another option. This is Korean acupuncture. Korean acupuncture put 12 meridian, 14 meridian on hand. And over here, in the middle, and the third, this is third, right? Third metacarpal bone. On the third metacarpal bone, and here in the middle, this is 2 meridian. So I give you a picture over here. This is one patient come in for infertility treatment. So I used 12 magical point. I took the pulse and a needle. This is all small needle, you see. This is Erjian. This is Zigo. I needle those. And this patient said, I got a lot of pain in my lower back today. You know, and this is, I think is Hoxi. And I needle all 12 meridian. And she got better from back pain. So the side of the pain is gone, like the bladder meridian pain is gone. And actually on the, let's see which side is it. If I treating that hand, it'll be in here. Okay, over here, closer to the left side pain. Left side is over here. Yeah, left side. On the left side, bladder meridian and Hua Tuo Jia Ji as well as 2. So after 12 needles, I treat the organs. When the organs better, the pulse better, and the pain went on the bladder meridian, but not the Hua Tuo Jia Ji and Du Mai. Not for those 2 areas. Then I add more needle on the third metatarsal bone. 4 of them. One is just in the middle of the third metatarsal bone. The other one is off in here to treat Hua Tuo Jia Ji. And after 4 needles, I get her to sit up and lay down, because she told me the only position that you feel worse is sitting up and laying down. And this, and between these 2 positions, then she got very painful. She experienced very painful back. Then after those needles, I get her to get up and lay down a couple times. She said, there's no pain. That's it. So this is the local balance. On a global balance, you allow and you can add on more needle for what? For local balance, to treat the symptoms, to treat the painful conditions. So Sue may ask, what position should the patient be when doing needling, sitting or other position? I normally, because I have bed in my clinic, for the first patient, first time to come for acupuncture, always get them lay down. Okay. If the patient doesn't like needles, lay down. If the patient's scared of needle, lay down. If the patient get used to the needle and come a lot of time, they can sit for needles, and that's fine. But I want the patient, because I always treat the organs, I wanted to have a sleep for 15 minutes or 20 minutes or half an hour. I always get them lay down, because we have plenty of blade in a bed massage table in our clinic. Right? If you're doing community acupuncture, that's okay. The patient can sit there and just roll the sleeve up, and you can do acupuncture, no problem at all. For 12 magical point, yeah, you can do that. Sitting is fine, no problem at all. I do sitting. I tried it before. You know, just not often on my clinic. But when I go out, anyone need acupuncture, I give them acupuncture, they're sitting. We don't have bed. I do it on my mom and my dad, they're sitting, no problem at all. Okay, now I do have to tell you something. And here, as I remember, pregnant woman, you don't needle this point. The last intestine point, back 5 point, okay? Same as Hergu, you don't needle it. Do not needle it, okay? It's fine to needle it, but according to the book, do not needle it. So I would say do not needle it. Because if anything happen, you know, they will come to you. So we have a lot of options when it comes to distal acupuncture. I'll tell you what, you can do 5 neck point for lumbar pain. So why is that? Reverse image. This is lumbar. Reverse image. I have patient come in, pregnant women have back pain. You don't needle back, right? But you can needle here. So I use reverse image, needle here. Bang. The patient's pain gone. So simple. While you work good for, would you do 12 medical and then local in one session? Yes. You can. You can, yes. If you do, like we talk about medical 12, right, or global balance, if you are using meridian conversion, or if you're using seasonal balance, how Dr. Tan originally told us, you're not going to add any local balance. You can't do it because as soon as you add needle on those meridian, you're gonna damage the gua. But in my method, doesn't matter. You do the pose, you needle the point, that's it, you're done. And you want to add more point, you can continue do the point, and it's gonna give you more effect rather than damage the gua, because we're not doing gua. Depending on what theory you're applying those points. According to Dr. Tan, when you do gua conversion, you do not do, so it comes with a problem when you treat the organs using meridian conversion, right? Because the patient have internal disease and then they have pain, and you know that a lot of time the pain went, the pain just went, but sometimes the patient still suffer from pain laying there and say, I still have pain, very uncomfortable. And I used to stuck in there, do I want to aid on local balance or not? Because as soon as I add it on, I'm gonna damage the gua, and I'm not gonna treat the organs. So my theory against my own theory. I can't do any. I want to do it, but I worry. So that is why I found another way that your theory is not gonna fight your theory. A local balance is not gonna fight global balance. They're gonna help each other. Does it make sense? All right. In these cases, if the patient, we're talking about L2 pain in here, 12 meridian. If the pain move up there, you're gonna move the needle up. If the pain going down there, you're gonna do that. Elbow L2, wrist is tailbone level. So between tailbone, the pain between L2 and tailbone over here, you're gonna treat it halfway between elbow and wrist. Same in here, halfway between knee and ankle. You get me? So if you treat here, if the pain is in upper back, this is neck. So you're gonna do upper band, upper arm. If it's between here, pain is in here, you're gonna treat in this level. Same as here, same as the thigh in this level. You make sense? Does it make sense to you? Well, they work for the lower back pain with sciatic pain. Sciatica. Yes, it will. It will. But for sciatic pain, the pain goes down to the legs. You need other strategy for that. For pain transfer from here to here. The most strategy we do is sancha. Sancha is from tongue acupuncture. So 1, 2, 3 needle going to that. That is for anything transfer from one to the others. The pain radial from one place to the other place. Winnie, does that also mean upper back treats upper arm and lower back treats lower arm too? Yes, it does mean that. But if you know how to do reverse, then you can use lower arm to treat upper back, and lower arm to treat lower back, to treat sacrum, to treat everything. Okay, if you know how to do the reverse image. So we have about 9 minutes. I know you have a lot of questions, so I'm going to keep going. I'm going to tell you the bonus, but then now I'll come back to you. I know you have a patient with lower back pain. I'm going to come back to you. Don't you worry. So the bonus. So we're going to close our workshop soon, but we'll stay in here. I'll let you know how to get the bonus. Let me. This is how you get the bonus. So follow the step. So if you want to get free medical aid to treat heart disease, respiratory disease, and digestive diseases webinar, if you want to get this webinar, a free one, so you're gonna do something for me. All right, please write a Google review for our new Auckland clinic. Okay, so it's a new one, so we haven't got any Google review. So I want you to help me to boost up my Google review. So sign in your Google Mail account first, then click the link, which I posted over here already. This is the link. I'm going to post it again. So you have to sign in your Google Mail first, and then you sign in first, then you click this link. It'll bring you to a page on a Google page, and then it'll show you in here like this: Center of Balance Fertility Clinic Auckland. Then what you're gonna do is, I'm hoping, of course, you give me 5-star. Then you write some honest review for me, like about my vlog, about my video that I've been posting, and about my webinar, right? So then the step 2 is you screenshot your review and send it to our email, info@acupuncture-tcmschool.com. So my team will send you the bonus video link to you. All right. So I want you to, if you have any question, attention in here. If you have any question or any suggestion for my webinar, all right, you send an email to me. Just send an email to us, So this review is about what you think about me, Szenan, or the thing that I present to you, okay? This review, Google review, is not for you to ask questions. It's not for you to suggest what I need to do. I have the other, for the next 5 points. Someone asked and said, someone went there and said, put a review and then put 3 stars and said, your webinar is too late. I was very sleepy. Can you do early? You ask this question, come on. If it's too late for you, you don't have to join my webinar. I don't force you, Don't put this silly things on that, okay? This is my only, and again, if you don't want this free bonus, you don't have to do the Google review. You don't have to do that. You have a choice, okay? I'm not forcing you to do it, okay? If you wanted to and you love my video and you love my talk, love my webinar, yes, go and help me and do a good review for me. If you don't like me, you don't want the bonus, that's okay. You don't have to do it. I'm not here to force you to do that, okay? Now, thank you for all your time, and contact us at info@acupuncture-tcmschool.com. Now, if you want to join my workshop in Auckland, tomorrow is the last, is the in date of super early bird. All right. Thank you very much. Yeah, Sume, you laugh, right? I did. I was very confusing. Why, if you have a question, why don't you just email me, ask me, why do you want to put your question on Google review? I was very confused when I look at that. I was laughing. How silly. Thank you. If you don't have a Google Mail, you just have to register a Google Mail. But hey, if you don't need the bonus video, you don't have to register the Google Mail. Yeah, okay. I'm gonna come back to you, Banana. Banana, I have a patient with lower back. So I schedule about 2 hours and my cut off. I will come back again if the cut off, okay? And since I haven't cut off us, well, I'm gonna go to until the webinar cut off, and I'll come back again, log in again. I don't know, because last time it actually cut the whole thing down, and I have to come in again. Lower back pain, low level pain, and for the rest of you, if you want to go to bed now, you're allowed to go now, and because we're finished now, I just go through some question, and you're allowed to go, and I'll send you the certificate to your email. And if it's not in the email, please join our Facebook group. In our Facebook group, when you join in, I'll get the Facebook group for you, the link. Where is the link? Where's the link? There is some link that you can join our Facebook group and YouTube channel. Like or subscribe to our YouTube channel as well. Then whenever I have a video up, and you get notification, you watch it, you won't miss out. Okay, so we'll post the certificate on our Facebook closed group as well. Elena, I'm looking for your question. I'm sorry. Off the topic all the time. Okay, patient lower back pain, low level pain, but extreme pain in both legs. Do I need to add local balance point for leg pain, or will global balance treat the leg pain? No. Now, this is a real case, right? Good question. Banana, very, very good question. Extreme pain over here. I assume, I don't know your patient, which meridian, okay? I assume the pain is all over the leg, right? So you can do a global balance, and you ask the patient, how do you feel right now? Is the pain reduced? If the pain doesn't reduce, it local balance. But sometimes with global balance, the pain will just be gone. Everything will just be gone. And you don't know until you try it. Needle it, and the pain's there. If the pain is from here to here, now you want to do global balance from here to here, according to which meridian is there. So which meridian to treat? Go to my Acupuncture 123 free webinar. I actually teach everyone how to do Acupuncture 123 from step 1 to step 3, and I actually introduce 3 systems, and that's good enough for local balance, including the contents today you learn. I think it will treat these conditions because the image is quite big, the whole leg. Then this is multiple needles. We will talk about in the clinic, in the workshop, how to treat this severe pain with multiple needles, you know, and why multiple needles, and when we use less needle technique, and that's it. Okay. So any question time? Anyone have any question? Just bring it up. Thanks a lot. Always Dr. Szenan-Balance. Thank you. Join. Kathy, thank you. Takayuki Hashimoto. Are you in Japan? Thank you. Alicia. Alison Pin. Thank you so very much. I will go ahead and attend your course. Welcome. Yeah, come in and go ahead and sign up. Leon Jiang, thanks. Thanks. Thank you. Kim, thank you. Tran, thank you. Han, thank you. June, thank you. Darwin, thank you. Belinda, thank you. Wei Ho, thank you. Michelle, wonderful, very helpful. Thank you so much for Michelle Welsh. Thank you. Thank you so much. Many thanks for your time and wisdom. Thank you. I'm in Facebook. Thank you. Awesome. Thanks. Thank you. Wow, that's a lot. Thank you. Aaron, thanks, mate. Well done. I'll have something special to share with you when we catch up next month. You'll find it interesting, I'm sure. That's great. Thank you, Aaron. Thanks for today. An email you told us there is test to get NZASA CPD certificate. Can you tell me how to get it? Now, Kim, Hyun Song, Kim, we will send the certificate to you. We have got your email already. If you attend this, we'll got your email. So don't worry. And go and sign up the Facebook group. Go and join our Facebook group. There are two on top of that. One of them is acupuncturist one. So you want to join the acupuncturist one, and you want to go to the YouTube video as well. So when we send you the email, I will put the certificate on our closed group. Okay, and closed group, you're allowed to ask any question you want. Okay, and I will help. Okay, I promise I will help. I love to share, and I want you to share as well. If you have any question, you ask. If anyone have any question that you know you have a good idea for them, share your knowledge. Sumi, appreciate, no problem. That's amazing. Thank you, Belinda. I will follow acupuncture 1, 2, 3. This really helps. Winnie, thank you so much. I have done the review and registered and paid for your workshop. Oh, thank you, Winnie. I'll see you next month. Good night, Sumi. Thank you very much. Understand more when learn the second time. I will practice when you thought. Ran, thank you. Now waiting for your bonus video. I have to get my team to send you. I have no time. Well, you definitely get it. All right, you definitely get it, Winnie. No problem. I think before next time you meet, before the workshop, before we meet in the workshop, you will get my bonus video. Su Chun Su Xu. Yeah, please check your email. I will go to your workshop next month. I'll see you then. See you soon. I'll see you then. Good things. Any question? I love questions. Just give me some question. Can we treat cerebral partial with acupuncture? Good idea. Where's my cell phone? Yes, balance method is great method. If I can find my cell phone, I lost my cell phone. Because I can show you my bowel palsy patient, little kids, and how I treat that. I think I left my cell phone in my car, so I can't show you. And actually, I just thought about I should show you guys this picture. So in this course, we talk about, what? In this strategy, we can treat structural problem, right? What's a structural problem? Does herniation this problem is one of the structural problem, right? Can balance method acupuncture treated? Can 5 back point and magical 12 back point treat this? There's a question for you and for me too. And according to Dr. Tan's, balance method acupuncture doesn't work well for structural issues. But guess what? look at here. This patient, this is L5S1 protrusion of this and lumbar, and this one a little bit, and those are okay. And what did I do? I used balance method acupuncture to treat her, and she was fine, no pain. She came in January 2016. Then we get rid of the pain, and then she was fine for a few years until last week. She came back to see my colleague with back pain. I do a combination treatment. I do balance method acupuncture, scalp acupuncture. I do herbs, and I also needle way 拔疗, because she respond to 拔疗 very well. So we use combination treatment, and then balance method acupuncture work for her very well. Yes, balance method acupuncture can treat structural problem. In Chinese medicine, we treat structural issue as well, but you need to look at the whole picture rather than just using one technique to needle to fix everyone. If you need herbs, you need to use herbs, okay? Because according to 黄帝内经, in some cases, you just can't use needles, but in which cases you can use needles. Then when we come to post, we will have an answer for that. Okay, now I have the bell palsy picture for you before and after my cases. I don't have the cell phone with me, so I can't show you. It's definitely in my car. Yes, we can. Yes, can we treat? We can treat bell palsy when this cerebral palsy and using acupuncture. Yes, we can. Needling contrary or on the same side. I don't know about your question in here. We can do the opposite side on the same side. It's okay too. Thank you very much for your time and sharing all variables free. No problem. Jihi, he won't leave. Good night. Good night. Phoebe, due to reverse image for local balance, can we do the same global balance for lower back and neck pain? Yes, you can. You're so smart. Yes, you can. Definitely okay. No problem at all. Thank you so much. I'm already signed you both Facebook. Yes, Kim, thank you. I would like to join the Acupuncture 1232. Yes, I'll send you all the email. When you sign up, I'll send the email link to you guys. All right. See you in the workshop. See you in the workshop. Sing form from Christchurch, right? Alicia, is the link to your 123 webinar on Facebook? Yes, I'll send you the link as well if I can find it over here. Give me a minute. Oh dear. I'll make sure I send it to you. I can't find the link at the moment. But if you, I'll make sure I send it to you. If you haven't received it after the, with the certificate, then you reply us and ask for the link for Acupuncture 123, a free webinar. Alicia, Alison, I think it's on the Facebook. You want to find, you have to, because I have a lot of live webinars, so you might not get to the one and the link, but I'll send to you. Okay. Why we cannot make the reviews for you in Facebook instead of Gmail? Good question. Is it very complicated and not convenient? I do not have a Gmail account. I need to create a Gmail to get your bonus. Right? Yes. Weiho, yes, you have to create a Gmail. So this is about marketing. This is about marketing, because most people use Google to search our clinic, to search acupuncture. So I'm trying to build up my business, my clinic. So people won't come to Facebook, and Google won't suggest Facebook review. Google suggests Google review. So if people search acupuncture in Auckland or acupuncture near me, so our clinic will come up, and we have review, and people will click in to look at your review. If your review is, you talk about a webinar, that's good, and people know about we are teaching other people, and they build the trust. Oh, this is real. These people doing acupuncture is real, and they not only doing acupuncture, they actually deliver webinar to help other acupuncturists improve the skill. So we just build up this is what we do. So this is the positive message to my patient to help them to decide to come to see us. So this is about marketing. When you being an acupuncturist, you want to know, you want to do some, you are doing you are in business, you are in business. When you're in business, you want to know how to do marketing. And now all people use cell phone and computer. In the past, you do yellow pages, but no one uses yellow pages now. All young people go online. Then Google review is one of the most effective thing for people, to help people to understand what we are doing. Okay, so yes, I'm sorry, you just have to get to create a Gmail account, and it's very simple. Create a Gmail account. I have a few Gmail account for different purpose. Winnie, can balance acupuncture method to treat coronavirus? Good idea. I have no cases, Winnie. I wish I have a case for that. But think about it. Coronavirus, right? What is the symptoms? And there are 57 cases, mainly using Chinese medicines and with Western medicine together, and successfully treated, and they are out of the hospital now. 57 cases, right? With acupuncture, with balanced method acupuncture, I believe you can, because balanced method acupuncture is going to improve the immune system. So what strategy can improve immune system? Before you get the virus attack you, you want to improve your immune system. So medical aid is one of the option strategy for that, because it can treat heart, lung, it can treat digestion. So immune system are based on digestive system, stomach and spleen, and lung. So medical aid, then medical 12 as well. It can improve the immune system. Apart from needles, what else can we do? You have to eat well. You have to rest well. If you keeping needle in there and the patient's not sleeping, stay whole night and watching movie and reading, and until 2 or 3 o'clock, and then went to bed for a few hours and then get up and go to work. And you want to use acupuncture to improve the immune system for them. That doesn't make sense. All right. So we have to be it need to be make sense, In theory, yes, it can, but in reality, we don't know. I never had the chance to try, and no one has a chance to try. You see, Maria, I hope you can also do a webinar on shoulder pain, frozen shoulder, and deadline. Thank you so much. Yes, Maria, we will do the I hear you. Okay, we will organize it. I mainly do the workshop because giving you this course, I hope it really help you. But it really help you how I get to those points. It's a theory behind that. So I want to, if I show you all this point, like 5 back point and magical 12 back point. It can help, it can treat back pain. You know, according to theory, that's 100%. But in reality, it's not going to treat all the back pain. It comes with strategy. You can treat 100 patients with back pain, and this strategy gonna work for 80%. 80 people gonna get better from this strategy. But what about the other 20%? Those 20%, you're gonna use other method. And now where's your theory? The same theory that developed this 5 back point and magical 12 8, magical 12 back point. You need to learn the same theory. When you learn the theory, you know the logic, how to get to the 5 back point, and then you can get the theory, go to another 5 back point and another magical 12 strategy for back pain. You see what I mean? This is the purpose that is why I introduce you a quick and dirty way. You can use it in the clinic straight away. You don't have to think so much, but you really want to learn the theory behind it. That's why we offer you the workshop, that you come in, you learn properly. And again, a lot of people learn all this theory and they go back to the clinic and they have question and they don't know how to ask question and they don't know where to go and they have to wait until next workshop. And I'm different. I'm online all the time. If you have any question, you're on our group, you ask the question on our group, I'll give you the answer. I'll help you. I'm always there. And if I'm too busy, I haven't got to your message to you, and we have group in there, and other people have idea, they will help you. So I want to create a healthy environment, healthy Facebook group that everyone can help each other. As long as you don't be shy, you really ask your question. If you ask, you get what you want. So first, ask your question. And thank you for asking this. We'll keep it in my mind. Frozen shoulder, Jinglin Wang. Wish we could have more webinar like this. Thank you. Huan Li. Darwin, already review your Google account. Thank you. Winnie, can balance method treat infertility problem? Yes. Yes. Yes, I use it all the time. Yes, I use it all the time. Yeah. We both, I think, Winnie, you been to Kirsten, right? Kirsten will show you how her clinic physician, how her acupuncturist use balance method acupuncture to treat a fertility patient. Yeah, infertility, yes, it can. She saw a few cases. It's all based on global balance, OBGYN. You know, it's all based on that. Wish we could have more webinar like this. Thank you. Does it any question at all? I love question. And 2 more minutes. If there is no question, we're gonna close this. We're gonna finish this webinar. And thank you for your supporting, and thank you for giving your time tonight and be with me in this summit webinar. Irene Locke. Irene, I'm seeing that you are typing. I didn't know that you're here. Yes, I'll send you the notes. Yes. Because my system only allow me to upload 3 MB PDF, and all my notes are a lot of image in it. So I normally just put it on Dropbox or put it onto Google Drive. Then I'll share the link to you guys. So if I put it on Gmail, you do have to have a Gmail account to be able to download sometimes. I think that's how it works. So with the last time one, I actually send you guys the notes as well. Put it on a PDF. Yes, the PDF will send it to you guys. Aaron, don't worry. We'll have a lot of questions in your seminar. No problem. I love questions, to be honest. And to be honest, I don't have all the answer for you guys. If I don't know, I'll say, I'm sorry, I don't know the answer. Okay, if I know it, yes, I'm happy to share. And if anything that I don't know, and you know it, and I would like you guys to tell me, because I'm always in a position to learn and learn and learn. You know, I'm always in a position too hungry. Okay, I think 2 minutes up. It was 20 and now 10:22. Now, thank you very much, and I'll see you next time. And wait for my email, right? Stay awesome, and I love you all. Bye bye.